Hello, my name is Mitchell Hagopian, and I'm the managing attorney for the Community and Institutions team here at Disability Rights Wisconsin. And I want to talk to you a little bit today about our community services priority under our PAIMI grant. A major PAIMI priority for DRW is to ensure that people with serious mental illness have access to appropriate and adequate array of benefits and services in order to promote recovery. We address this priority through individual and systemic advocacy. Our individual advocacy for adults under this priority involves ensuring people with serious mental illness are able to enroll in and benefit from the various Medicaid-funded community-based mental health services so that they can avoid institutionalization. These include the Community Support Program, comprehensive community services, and targeted case management. Our advocacy involves helping people navigate the eligibility process for these programs, and then ensuring that the actual services provided through these programs meet the needs of the individual and are consistent with the individual's preferences. Our advocacy typically involves meeting the individual, reviewing care plans, meeting with relevant county and provider personnel, suggesting changes and improvements to those care plans, and making sure that services in the plan are delivered promptly and adequately. We do not use our PAIMI funding to assist people in the process of establishing eligibility for supplemental security income or Social Security disability insurance. People with issues involving those programs should contact their local Aging and Disability Resource Center and speak with the local disability benefit specialist. They can help you with these issues. For people with a mental health diagnosis and a co-occurring physical or developmental disability who are involved with the Family Care or IRIS long-term support programs, DRW has a state-funded program known as the Family Care and IRIS Ombudsman Program that can help them in disputes involving their eligibility or adequacy of the services they are receiving from either Family Care or IRIS. Finally, for people in community-based Medicaid, because of their SSI eligibility, DRW has a state-funded SSI managed care external advocate, and that program can help people access appropriate Medicaid services, navigate the enrollment process, and understand their appeal and grievance rights. For children and youth with severe emotional impairment, we also advocate on their behalf in the Children's Long-Term Support Waiver and CCS, Comprehensive Community Services, as well as the mental health wraparound programs that operate in Dane and Milwaukee counties. This advocacy includes ensuring that eligible children are found to be eligible and do not have to wait for services, and that the support plans developed on their behalf meet their mental health needs. This advocacy typically involves working with the family, the county, and DHS, and sometimes involves representation at an administrative hearing. We do not assist children or youth in the process of establishing eligibility or establishing disability status for purposes of eligibility for supplemental security income, Social Security disability insurance, or Katie Beckett Medicaid. We also engage in systemic advocacy in this area. That advocacy includes regular meetings with DHS administrators to discuss emerging issues and concerns in the long-term care and mental health system by co-chairing the Survival Coalition of disability groups and convening the Milwaukee Mental Health Task Force. During the COVID pandemic, we have also met regularly with the state Medicaid director to influence policy relating to increased isolation, stress, and anxiety experienced by people with serious mental illness during the pandemic. And that's a little summary of our PAIMI priority as it relates to community services. Thank you.